afternoon, everyone. Thank you for coming. We're here to provide an update to the community about the City of San Antonio and Bexar County's efforts to deal with the current surge of COVID-19. We'll discuss the current demand for testing, what we're seeing at our local hospitals, and what the city and the county are doing to stop the spread of the virus. We know it's been a rough past 2 years as we combat COVID-19, and we understand that many people are experiencing pandemic fatigue that affects you emotionally, mentally, and physically. We're all human, and that's okay to feel overwhelmed and vulnerable, especially during these trying times. You're not alone. I'd ask you to think about the teachers, the doctors, the healthcare workers, the nurses, the firefighters, the first responders who have been dealing with this alongside all of our community. Just when we thought things were taking a turn for the better, we do find ourselves, however, amid another COVID surge, all due to the Omicron variant. Our risk level remains severe for the third consecutive week, and just as we expected, our positivity rate once again increased this week to 38.3%. We've seen positivity rates in major metros of the state of Texas over 50% in some parts of Texas at this point. Should the current trajectory continue, we'll find our risk level in the critical category. Although it's hard to tell if we've yet reached our peak, or when we will reach our peak, we continue to monitor the data and situation constantly. Of course, we all hope for a decline very soon. We need to work together to get through this winter surge, and there are actions that we can take. For everyone who has taken the time to get vaccinated, that's the first and most important step, along with getting boosted. If you are eligible for a booster and you haven't been boosted yet, go get one. You are not up to date if you haven't. Thank you for doing your part to protect yourself and your loved ones, your family, our community, especially those who are not able to get vaccinated, such as children under 5 years old. Remember that COVID-19 vaccinations are available to everyone ages 5 and older, and we continue to ensure that these free vaccines, again, they are free, and they are available to all residents in neighborhoods all throughout the city. Vaccinations have been a key strategy in keeping you protected from COVID-19, and they help us slow the spread of coronavirus. Again, we urge everyone who is yet to get vaccinated to please make an extra effort to do so. Over the past several weeks, we've deployed more resources to help contain COVID-19, and we've requested more, and we've received more resources, such as additional nurses and testing sites from our state and federal partners. I just recently, in fact yesterday, was meeting with the federal administrator about the reimbursements and the resources that have been headed our way and that will continue to from our federal government. Because of the rampant spread of the Omicron variant, people are urgently seeking to get tested. On Tuesday, the City of San Antonio, with the support of the Texas Division of Emergency Management, opened a federal COVID-19 drive-through testing site in Lot C of this building, the Alamo Dome, as another option to get testing for our community. We know that there are still long lines because there are a lot of folks seeking to get tested, and the wait times are exceeding many of our patients' levels at the test site. So we're doing all that we can to help alleviate those challenges, and please know that these are experienced challenges everywhere in our community and across the country, and are largely due to laboratory slowdowns because of the volume of testing that's occurring all throughout our nation. We encourage you to register today for an appointment at a federal drive-through site. If you're looking to get tested, you can go to doineedtogetacovidtest.com. As simple as that. doineedacovidtest.com. Let me get that right. doineedacovidtest.com. Or you can call 1-800-635-8611. Hours are 7 a.m. to 5 p.m. Monday through Sunday, and they're free. The City of San Antonio also recently opened 6 mass testing sites in partnership with the nonprofit organization Community Labs, and we're offering an additional 20 testing sites through our partner Curative. For information on any of these testing sites, please visit covid19.sanantonio.gov and click on testing, or you can call 311 and hit option 8. Through these combined COVID-19 testing sites, the City of San Antonio and Bexar County now has the capacity to test nearly 12,000 people per day. So again, it's going to take teamwork for us to get through this latest surge. Please continue to do your part. Mask up, get vaccinated, get tested, and if you have symptoms of COVID-19, which mimic many other symptoms you might have during a respiratory season like we're in, please help us contain the virus by staying home if you are sick, and get tested. Thank you very much, and let me introduce Bexar County Judge Nelson Wolff.
As the mayor said, we've got a number of testing sites throughout the community. The one that we have over at the Wonderland Mall, and then with Cone Corazon, they're getting a lot of people tested. We're so successful at it that there has been somewhat of a backlog in community labs in terms of getting the results out timely. So they're working hard on that. It's not an easy process. The mayor and I took a tour of community labs, and it's a very comprehensive lab. When you're taking a PCR test, you can be sure the results are going to be right, but there has been some delay in it. We're glad the federal government stepped up with a testing site, but I think we were quite a bit ahead of them and have done a good job of providing a number of testing sites. It's never too late to get the vaccine. Just since January the 3rd, we've given another 8,473 vaccinations at the Wonderland Mall, and plus we've given another 2,156 to children. So don't forget that whether you had COVID in the past or not, if you come and get a test, get a shot, you're going to even be probably more protected than anybody would be protected. So take advantage of the vaccinations, take advantage of the test, be careful in what you do. You never know today where you are and who's got COVID around you, and that you don't want to pick it up. I think our hospitals are doing a great job in handling the patient flow we have. We are getting in people. I was just talking to George Hernandez, CEO of UHS, just a few hours ago. We're getting in patients that are getting sick with something else. Could be a number of different things. But then when they come in, they're also tested and have COVID. So we still have quite a few people in the hospital, and the ones that you obviously the concern the most about are the ones that end up in ICU, and I think we've got a little over 260 people in intensive care units now. So be careful. There's hope that we can work our way through this by the end of the month in January. A lot of models are predicting that, but we don't know that for sure. So just be careful. Do all the proper safety protocols, get your vaccination, get your test. Thank you. Claude Jacobs, head of Metro Health, is going to come speak next.
Thank you, Judge. Good afternoon. Before I share with you the latest data and statistics of the pandemic, Metro Health is again reminding the community that COVID-19 vaccines work to help prevent infection as well as serious illness or hospitalization. It's also important to note that for individuals who are fully vaccinated but have breakthrough infections, they are far more likely to have mild or no symptoms at all. We mention this because people have asked, well, why should they get vaccinated when they hear that people who are fully vaccinated are still getting COVID-19? Breakthrough infections are not uncommon, and you are far better off being vaccinated than not. So here's a quick update regarding what we're seeing here in San Antonio and Bexar County. So total cases of COVID-19 reported to date is 437,687 reported cases to our department. A total number of new cases reported yesterday, 5,841. Our case rate per 100,000 is now 262.8 compared to where we were a week ago, where it was 181.8. Our 7-day moving average is now 5,970. And regarding our vaccination rate, again, the best way for us to be protected as a community, we're now showing that 88.5% of individuals, eligible individuals 5 and older, have received at least 1 dose, and over 72% of individuals 5 and older are fully vaccinated. Keep in mind that 447,436 individuals have received a booster or 3rd dose. So while Metro Health encourages people to get tested if they are experiencing symptoms of COVID-19, we are aware that individuals are having to wait longer than 24 or 48 hours to receive their test results. Because of the highly transmissible Omicron variant, we are seeing an unusually high volume of individuals seeking testing every day, and you've heard that already. Area labs are dealing with a backlog of tests compounded by inclement weather and reported staffing shortages, and we are working diligently to get those results back to residents as soon as possible. We'd also like to remind the community that you can order 4 free COVID-19 test kits from the federal government to order visitcovidtest.gov. Again, that's visitcovidtest.gov. There's an important matter we would like to bring to the public's attention that we've also been hearing about. Metro Health is aware of fake testing sites popping up across the city. It's also happening in other cities. Individuals who are operating these fraudulent sites are only interested in your personal information. They are not running tests correctly, so even though you might be positive for COVID, they could tell you that you tested negative. The free testing sites listed at covid19.sanantonio.gov have been vetted and are legitimate. Look for these red flags to determine if a testing location might be a scam site. 1, there's no logo or any organization's materials. 2, the pop-up tent is in the middle of the sidewalk or in an unusual location. 3, it's not affiliated with the storefront or building where it's set up or any local healthcare organization or medical provider. And 4th, there's an upfront cost. Again, as you've been hearing, these are free of charge, these services, so there should not be a charge. What you can do to this, if you do suspect that you are at a fake testing site or fraudulent testing site, ask what lab or medical organization they are affiliated with, and then call that facility. Check out their website. Or you can report fraudulent testing to ftc.gov/complaint. So Metro Health continues to monitor events and patterns around the globe to assist our residents during these most unprecedented of times. Remember that our Alamo Dome drive-through site, again, which you're here, is open from noon to 8 p.m. Wednesdays through Fridays. No appointment needed to get vaccinated. Again, be safe, be well. And now I'm going to introduce our medical director, Dr. Jinder Wu.
Just want to check something because, all right. Yeah, all right. Vaccination is the key to keeping our schools open, and we can do better. Only about 14% of children ages 5 to 11 have had both doses of vaccine in our community. And as the total number of children with COVID increases, the hospitalizations are increasing. So right now there are about 35 children, more or less, in the hospitals, which is not an enormous number, but it's entirely too many when you consider that this is completely preventable. Protect your family, vaccinate your children, ages 5 and older, vaccinate and boost your children ages 12 and older. Metro Health is offering the booster at the Alamo Dome, at the pop-ups. Boosters for this age group were recommended 2 weeks ago by the CDC. The version of the vaccine that's given to 5 to 11-year-olds is a lower dose. It's very well tolerated. More and more studies show that there's no cause that more and more studies show that the vaccine does not cause infertility. These are studies in couples that are trying to conceive. And although it could seem like the vaccine was developed very quickly, the scientific foundation was built up over more than a decade. By having your children vaccinated, you're not just protecting your family, you're helping schools stay open and fully staffed, which helps our entire community. Vacunar a los niños es fundamental para mantener abiertas las escuelas, pero necesitamos mejorar la tasa de vacunaciones en los estudiantes. Solamente el 14% de los niños de las edades de 5 a 11 años ha tenido 2 dosis de la vacuna. A medida que demasiados de niños están contratando COVID, la cantidad de niños en el hospital está subiendo. Tenemos más o menos 35 niños en hospitales locales con COVID en este momento. Aunque no es un número enorme, todavía es demasiado porque es completamente prevenible. Protege a su familia, vacune a sus hijos mayores de 5 años, vacune y refuerce a sus hijos mayores de 12 años. Metro Health ofrece el refuerzo en el Alamo Dome para los adolescentes. En el Alamo Dome y las clínicas temporales para los adolescentes de 12 años y más. Y los CDC recomendaron refuerzo para este grupo de edad en 2 semanas pasado. La versión de la vacuna que se administra a los hijos de 5 a 11 años tiene una dosis más baja que la vacuna de adultos y es bien tolerada. Aumenta la evidencia en estudios con las parejas que quieren concebir un bebé que la vacuna contra COVID no afecta la fertilidad. Y si bien puede parecer que la vacuna se desarrolló rápidamente, pero la base científica se construyó después de décadas. La vacunación de sus hijos no solo protege a su familia, sino que ayuda a que las escuelas permanezcan abiertas y con todo el personal. Y en eso adelantará a toda nuestra comunidad. Gracias. And I am going to introduce Eric Epley from the Southwest Texas Regional Advisory Council.
Thank you, Dr. Wu. The hospitals are under great stress. Obviously, COVID-19 is a big problem. We have 1,257 patients in the hospital today. The unvaccinated rate in the hospital overall is about 67%. We have 260 people in the ICU right now, and 115 of those are on ventilators. And as Dr. Wu said, we have 35 pediatric patients. We've received 521 additional state contract staff from the state of Texas, and we certainly appreciate that additional support, especially with nursing shortages and people out with COVID is creating a great deal of stress. To that point, we really need you to help us in healthcare. We need you, the community, to come to the hospital if you have a true emergency. If you have signs and symptoms of COVID, go get tested. Go get tested at any of the sites that are listed on the covid19.sanantonio.gov website. If you are positive, contact your physician or contact a clinic that can help you and guide you through your course with COVID-19. If you have breathing trouble or other serious issues, of course, come to the hospital for true emergencies. Remember, when the hospitals are in high stress, we want to make sure that we're going to be available to take care of the critical patients, and that could be you or a family member. So please, if you're having signs and symptoms, go get tested. If you are positive, talk to your doctor, but if you have true emergency, come to the hospital. The other thing I'd like to mention is please go give blood. If you're a blood donor, it is safe. It is okay to go give blood. We're in a critical blood shortage right now. And honestly, it's as big a deal as COVID is right now. We're very low on blood, so please do your part on that and donate as well. I'll turn it back over to the mayor.
All right, that's it. Again, just thank you to everybody who's been doing their part. Please, again, remember, get vaccinated, get boosted, wear a mask, and we'll get through this. So with that, all the speakers behind me and myself are available for questions.